Why does lisinopril cause a cough? Have you ever wondered why some medications for hypertension come with unexpected side effects? One common issue is a cough linked to a medication called lisinopril. Let's break down how this happens. Lisinopril is an angiotensin-converting enzyme inhibitor. It is often prescribed to help lower blood pressure. By blocking the enzyme that converts angiotensin I into angiotensin II, lisinopril helps blood vessels relax and widen. This action reduces blood pressure and lightens the heart's workload. However, this same mechanism can lead to a persistent dry cough, which many people experience. The cough occurs because lisinopril increases levels of certain substances in the body, particularly bradykinin and substance P. Normally, the enzyme helps break down bradykinin, but when lisinopril inhibits this enzyme, bradykinin builds up. Elevated bradykinin can irritate the airways, triggering a cough reflex. This cough is usually dry and non-productive, meaning it does not bring up mucus. It often worsens at night, making it difficult for some individuals to sleep. Interestingly, this side effect tends to be more common in women and in those who do not smoke. For some patients, this cough can become bothersome enough to consider stopping the medication. While lisinopril is effective at managing high blood pressure, the cough can impact how well patients stick to their treatment plans. If someone develops this cough, there are alternatives available. Angiotensin receptor blockers, such as losartan, do not inhibit the enzyme and therefore do not cause the same accumulation of bradykinin. This means a significantly lower chance of experiencing a cough while still effectively managing hypertension. In summary, lisinopril causes a cough due to its effect on bradykinin levels in the lungs. This side effect is an important factor to consider when managing hypertension, as it may lead to switching to other medications to maintain comfort and adherence to treatment.